And I get the honor of introducing Scarlett Spring from TapRoot Interventions and Solutions.
Thank you very much. Well, I want to tell you all that I'm very happy to be here. Today is the first day that I'm actually talking publicly about the new company that I started this year called TapRoot Interventions and Solutions. A little bit about my background. I spent about 20 years in big pharma and came back here to the Valley. I'd been in and out of that market, worked a couple of years in economic development, and then I've spent the last 8 years with a company called VisionGate that used AI technology to look at early detection of lung cancer via a sputum test. That's a deep cough out of your lungs. And after leaving VisionGate at the end of the year, we're looking to sell that company, and I was serving as the president and the chief commercial officer, began to look at this problem around Alzheimer's and dementia. Let me start by asking you all, have you been impacted with a loved one, family member who has had Alzheimer's or dementia? Me too. My great-grandmother, it used to be called hardening of the arteries when I was a little girl. I don't know who remembers that. She had early-stage dementia, my grandmother, aunts, and uncles. And we're not alone. This is a problem with our aging population coming through the life cycle that really every 65 seconds someone is developing Alzheimer's. In addition to that, it doesn't discriminate. Men, women, as a matter of fact, if you look online, Japan has a crisis and actually has been dealing with their crisis of having one of the oldest populations in the world. So they're coming up with all kinds of social solutions to try to fix this problem. And right now in the United States, there's just under 6 million individuals who have Alzheimer's and dementia. And the problem is exacerbating. In this group, not surprisingly, they have more hospitalizations, and their hospitalizations are longer. One of the main reasons for both fatal and non-fatal injuries in this population is falling. Alzheimer's and dementia, patients just tend to fall anyway, and then psychotropic meds are used in this population to calm their behaviors, and that just exacerbates the fall risk. The average stay in the United States is about 8 days at $2,000 a day, so you're really talking about a large number. And if you look at that, you're approaching $100 billion of individuals with dementia in just their hospital portion. But that's not the picture. The big picture is $250 billion in 2007 was spent on this population. And with it growing, Medicare and Medicaid pays the lion's share of that, and with it growing over 300%, this is the tsunami that's coming if we don't do something. Now, that's only one side of the problem. The other side is we do not have enough caregivers to take care of this population. We're seeing it. Turnover is around 40 to 75% in this group. If any of you have a loved one in an assisted living facility, you've probably personally experienced this. In August of this year, there were a record number, almost 40,000 open jobs for caregivers in this space. That is double what it was just 2 years ago. So, problem's really not going away, and it's super expensive. Somewhere around $4,000 is what it costs to backfill these. So it's not hard to do the math that institutions are spending a lot of money on just the churn of caregivers. So it's very, very difficult to find these individuals. And this is where TapRoot is bringing in technology, platform technology, by use of a mobile app to try to impact both problem in the Alzheimer's and dementia space, but also how can we help these caregivers? So we're starting out as a B2B company. Our target population is assisted living facilities. We will use AI, machine learning in this population, and providing the tools for caregivers to de-escalate and prevent these Alzheimer's and dementia behaviors. Now, what are we talking about when we say the Alzheimer's and dementia behavior? Well, it's agitation. Sometimes patients will have hallucinations or delusions. There are times when they're combative. And as I mentioned earlier, it's not uncommon for psychotropic, sedation drugs to be used in that patient population, and of course, they certainly have a need. But you overuse these products, and it causes other issues. Quality of life, not to mention the drug-to-drug problems that you have, and because many of these psychotropic meds have black box warnings on them. So TapRoot is looking at how do we, I've conducted interviews, these are the phase 1 interviews, trying to get the user interface right with caregivers, and 5 key value propositions came out of these interviews. This first one was around having an automated response of how can you calm that patient down. Now, if you just go on the Alzheimer's website, it will tell you things like play music. That's actually a very it's true, but it's a very surface level way of trying to de-escalate that behavior. TapRoot is looking to provide a very tailored approach, tapping into the old brain of these patients whose current brain is experiencing a disease that is actually causing them a level of debilitation. You can't fix that. But if you can tap into the old brain to calm these patients down, we know that we can lower hospitalizations and their psychotropic meds. And that's the outcomes we're looking to prove. So the first value proposition was being able to load in a behavior and getting a tailored response. Secondly, it just goes without saying that being able to have this data in real time is valuable. Being able to train the existing staff. So you could imagine caregivers do very, very didactic training. You pull them off, it takes a day, you have to backfill. 5 minutes into the session, everybody's got their cell phone out, they're surfing the web, they're looking at photos, they're trying to decide, who's going to pick up the laundry that afternoon. Of course, as we all do in very didactic, day-long training programs. We want to break that. We want to be able to put 3 to 5 training programs, case studies that are very much about being able to say, what is the behavior that has been happening in our particular unit, and now tailor that so that the training is about relevant behaviors that are happening in real time. In addition, being able to share data. You can imagine shift time, whether it's in a hospital, whether it's an assisted living facility, you've got part of the group just trying to get out, you've got part of the group just trying to get in. And if it's not written down and at a nurse's station and someone stops to read it, you haven't really looked to see what is happening with that fragile patient, that fragile resident who's been having an issue that day. What we want to be able to do is try to make these shift changes as seamless as possible. And then, of course, it's the executive directors and your directors of nursing that really want to be able to pull some of the data. You could look and say, this assisted facility is actually displaying a real issue around resisting bathing, while this particular unit is on the other side of town is having a real issue with during mealtime. So you can now go back and not only tailor what's happening, but you might actually learn something about, are those facilities designed incorrectly? There's a lot of knowledge going into industrial design so that you're being able to keep these patients calm and de-escalate these behaviors. And so we know that we're going to be able to provide some of that data. So as I mentioned, the outcomes we're really looking at is how do we lower the hospitalizations? That's a part of the cost equation that's going out of control. Number two, how do we lower these psychotropic meds? Yes, we'll save costs, but more importantly, we're going to be able to save quality of life, and we're going to be able to impact the fall risk of these patients. Market size is huge. If you just think about the assisted living facilities, you know, there's about 1 million beds that are in the U.S., and this number is growing. As we mentioned, assisted living facility is going to be the first target market. Of course, memory units are very low-hanging fruit because they are facing these challenges every day. Tech trends are really happening everywhere in this space. As a matter of fact, if you saw the Wall Street Journal on October the 14th, I really found it to be very interesting that they talked about technology and specifically in the medical device space in elder. And I'll just give you a couple of quick numbers. This is about the percentage who think it's positive or somewhat positive to the statement below. And 75% believe that AI-enabled robots could help the elderly live longer in their home. This audience would probably agree with that. Also, 71% devices with AI technology where they will be doing a majority of the thinking so that you can have a less qualified caregiver. Interesting. And 68% technologies, including robots, could provide companionship for elderly people. So you have to think about, in the next decade or two, it is this dramatic chain that is going to be happening in this population. The economics is going to drive it, and technology is going to enable it. Competition. Interestingly, behavior health in this space doesn't get a lot of attention. It's not as sexy as on the medical side, although we know it works. So the three areas that we're really carving out is the patient record, how do we improve that, the on-the-job specialized training, and then of course, how do you provide these interventions to de-escalate and keep these patients calm. For 219, I've been working with a specialist in the space, Dr. Linda Buscemi, who's been in this area for about 15 years, and working through what are those interventions, what are those 25 to 26 key behaviors that we need interventions for. We are working with the Systems Imagination team, who's in the back, and we've built a database to look and see, does the proof of concept work? Have we passed feasibility? And indeed we have. Next year, we'll be moving to our MVP and our mobile application. We'll do lots of work around the user interface. Because of the high turnover of this caregiver population, it's got to be easy. It's got to be easy to be trained, and it's got to be something that's super intuitive for these individuals. So next year will be all about increasing patient encounter data. Looking into 2021 is when we'll probably go out for our first professional offering of funding, because at that point, we believe that we'll have a strong enough database, we'll certainly have a strong value proposition, and we'll enter into that market. And then from there, we're looking at what do strategic relationships look like, and on to greater things. So these are the three individuals. You'll have a chance to probably meet David Snyder, who's in the back. He's serving as our key technologist and helping us with our big data. That's Dr. Linda Buscemi, and myself are really the three at the heart of pulling this forward. So I appreciate your time. Thank you so much. This is a real problem. It's a real avalanche that's coming, and we believe that TapRoot interventions and solutions can be a part of the answer. I know that in a couple of decades, that'll be me, and I want to make sure that I give some tools to some people who can certainly help me to age with dignity and grace. Thank you.